We're going to go over taping if we've prescribed for you to have someone tape your neck at home to prevent pain with rotation, or to prevent pain if we've talked about trying to prevent you from getting into this protracted position. So we'll go over that right now and show you step by step how we want you to tape yourself or have your partner tape you on the neck to prevent those motions. All right, so we like to use a combination of Coverroll and Leukotape. Coverroll just protects the skin, and Leukotape is really strong. But you can use other tape if you have athletic tape available, or KT tape, or whatever it may be. We prefer this one. So if you're using the cover tape, you're gonna put that on first. You're gonna have your patient look straight ahead. And when you measure out the size of the tape, we're gonna go from right behind the ear, so the angle of his jaw is right about here. So I'm going just behind that, behind his ear. That's where the top of the tape is gonna go. You wanna make sure the tape is resting on the skin when you measure it out, not tight like this. So it's resting along the skin, and it's gonna go out towards the AC joint, so the end of the acromion. So right where the bone is on the top of the shoulder, right where it kind of falls off is the acromion. So we want that tape to go from there to there, okay? So I'm gonna apply this tape on, and I'll show you how we wanna put on the Leukotape. Okay, now when you're applying the Coverroll, it's best to put the top part on first, get that laid on there, and then you want to make sure you're putting it on loose. You don't want this Coverroll to be on tight. So I'm just going to gently, step by step kind of piece, inch by inch, just layer that down with the back of my hand so it rests really nice on his skin. Again, we don't want that Coverroll to be taut and lifted off his skin, or else it's going to be a bit more uncomfortable for him. Okay, now when I'm putting on the Coverroll tape, you're going to measure the same way. I usually like to take the back of the tape so it's not going to stick to him and measure it out. Again, you want it to kind of lay flat when you're measuring it, not pull it too tight, or else it's going to be too tight. So I'm just going to lay it flat. I want it to be a little bit longer. Then I'll cut my piece and apply it. Okay, now when you're applying the Leukotape, same thing with the Coverroll. I'm going to put on the top piece first, and then I really want to make sure his head's going to be in the right position. So we want to prevent rotation to the opposite side if that's your pain trigger, or we want to prevent protraction, or when the chin really gets away from your throat. This will help with both of those. So first of all, I want to make sure his head is neutral, facing straight ahead, not rotated to the other side. And I want to make sure his chin is close to the throat, not poking away. So we've already got him positioned where we want him here. And then same thing with Coverroll tape. This Leukotape needs to be tight, but I'm still only going to apply it about an inch at a time, so it's not overly tight. Okay. So we're pulling tight, and as I pull tight, I'm pressing down to the bottom of the skin. I got a little bit more than I wanted on the end, so you can just clip it off, that's no problem. Okay, so now I've got a nice piece of tape that's going to give him proprioception awareness when his chin tries to get away from his throat, or if he's rotated too far to the other side to help avoid his pain trigger. If you're having any issues with this, if it's not helping you with prevent those motions or give you proprioception with those motions, let your Zona clinician know so we can review it and see if there's any changes we need to make.